Did you know May is Mental Health Awareness Month? I know you knew. Steve Carlton is back with us this morning. Steve is the Chief Clinical Officer at Porchlight Health. He's talking more this morning about mental health awareness. Is it safe to say, are we oversimplifying it when we say that overall health really starts with mental health?
It does. Yeah, mental health is your health. It's a big part of it, right? And it really predicts how you think, how you see the world, how you behave, how you interact with others. So it's critical.
Okay.
We know depression and anxiety, they're the two most common, right? So what should people know about them?
Yeah, they are by far the most common. So depression really, it doesn't always just show as people being sad, right? It can show up as irritability. It can show up as sort of detachment. A lot of high-functioning people are struggling underneath with depression, and right, that stigma keeps them from coming in. And anxiety really is much more about fear, right? It's an overactive fear response. So people constantly worried, right? And again, both of these you might not pick up on right away.
Well, I want to talk about that. Are there signs if you have a loved one or a family member that may be suffering, whether it's anxiety or depression, are there signs that we should be picking up on that can help us maybe determine this and help them seek help?
It really is a change in behavior. That's what you're looking for. Obviously, the earlier you catch it, the better. And so asking people about it, having open conversations around the dinner table, especially with kids that you're trying to model, sort of things that we weren't necessarily taught when we were kids, is really important.
When it comes to depression and anxiety, is this something that lasts forever, or does it end up going away, or how can you treat it really?
Yeah, great question. So with depression and anxiety, they can be chronic conditions and they can also be situational. So it really depends. But similar to other chronic disorders, like think diabetes, think asthma, other health factors, some of them do require maintenance.
How about co-occurring disorders? Co-occurring disorders, can you explain what those are for starters, and how do you treat those?
Yeah, co-occurring is when you have both, when they're both occurring at the same time. So you have a mental health problem and you're using substances as well. And so more often than not, people are using substances to numb and to self-medicate. And so when they're both occurring at the same time, you have to attend to both of them.
And when someone wants to seek help, where should they go first?
Yeah, I think porchlighthealth.com is a great place to start. National Association of Mental Health, NAMI.org is a great place and has some really good information as well.
Steve, you've been a great friend of the show. We appreciate you coming in today on Memorial Day of all days to talk about this very important topic. Again, if you want more information about Porchlight Health and their recovery services, you can check out their website. Steve just mentioned it a moment ago, porchlighthealth.com.